We all feel stressed out from time to time, especially during the holiday season. And there's pressure to attend social gatherings, give gifts, travel, and many other things that can take a toll on our mental well-being. A recent study conducted by the National Alliance on Mental Illness, also known as NAMI, found that 2/3 of people with mental illness report the holidays make their condition worse. Well, this year might be especially stressful thanks to the ongoing COVID-19 pandemic that we're all dealing with. The loss of loved ones, financial stresses from work, and feelings of uncertainty due to a wide variety of reasons. And in this special edition of Healthy Connections, we're going to get an in-depth perspective on how our mental health might be challenged during these stressful times. Joining us is Anne Sutherland, licensed mental health counselor and regional director of substance abuse and mental health with the Florida Department of Children and Families. Anne, thank you for being with us today.
Thanks for having me.
You know, why is it that the holidays seem so stressful for some people?
Yeah, so I think that's a really good question. And I think my response to that would be kind of two main reasons. The first being that there's just so much pressure around the holidays. There's pressure to buy the perfect gifts for our friends and family. There's pressure to go and see friends and family a lot more often than normal, just a lot more social engagements than normal. And there's also a lot of pressure about spending a decent amount of money to buy those kinds of perfect gifts. And all of those things, I think, create kind of a perfect storm for people to feel really stressed. Another big item that I think happens a lot during the holiday season that can really impact people's mental health negatively can just be a disruption of our daily patterns. Oftentimes we're traveling more than we normally travel. We're maybe eating and drinking a lot differently than we are during other parts of year. Also, another thing to think about too is during the month of December, we start to have the shortest days out of the year here in Orange County. And so all of those things can really impact us just feeling good and us feeling like we're kind of at a good baseline in our regular routines.
And you know, when you change your routines, you change your patterns, you open yourself to triggers that really can incite mental health episodes. So what are some of the holiday triggers that people deal with? Yeah,
that's a great question. So to begin in answering this, I want to first define what a trigger is. So clinicians, we oftentimes use the word trigger just to mean something that impacts or alters our mental state. And so during the holiday season, we see a lot of ads on TV about it being the most wonderful time of the year. And we see Christmas movies and we hear Christmas songs when we're shopping at our regular grocery stores or whatever stores we're going to. We also often are hearing Christmas songs in the car, and all of these holiday ads and things that we see out there often, communicate to us that we should be feeling connected to people. We should be feeling happy. We should be feeling joyful. And for some people, they do feel that way. But for other people, they feel really stressed, or they might feel really sad or anxious, or maybe even kind of broken that they're not feeling the way that society sort of paints a picture that we should be feeling during the holiday season.
And one of the things that's really interesting is that there is a layer of stress around the pandemic in general.
Yeah.
And then you add this additional layer of loss where people have lost loved ones, friends, and it has been really difficult. What are some of the things that you recommend for people who have those multi-layered, just sort of the uncertainty of the pandemic mixed with the devastation of losing a loved one?
Yeah, that's such a good question. The holiday season is stressful for many, like we've just discussed. But when you add on to it the stressors and the grief and the loss around the pandemic, it's just the perfect storm for people to really feel at their worst sometimes during this time of the year. And so what I would say that people can really think about during this time are try to identify those sorts of things in your life that are health promoting, that make you feel healthy, that make you feel nurtured, and identify those things that make you feel bad or worse than normal. And then think about what you can do in changing your daily routines and lifestyles during this time to do more of what helps you and do less of what feels bad. Essentially, ask yourself the question, what's helping me and what's hurting me? And try to see what you could do to do more of what's helping you, and set boundaries with yourself and other people to try and reduce the amount of things that feel just extra taxing during this time.
Are there signs or symptoms that we as family members, loved ones, can see when someone is really having some mental health challenges?
Yes, definitely. So some things to look out for, both for yourself and maybe a loved one, would be things like shortness of temper, a shorter temper than normal, changes in sleeping patterns. So are you sleeping more or are you sleeping less than you might normally be sleeping? Eating, are you eating more or are you eating less? Also, a difficult time paying attention. And then also, prolonged feelings of sadness and hopelessness. Those are all signs that, maybe some mental health challenges might be present.
Right. Undereating, overeating, all of the things that are just outside of that person's normal personality.
Yes,
it's really
exactly.
important to look at. What are the tips that you have for people who really are struggling to get through this holiday season? Maybe they generally don't struggle with the holidays. They're all unique lately. And also for people who normally have anxiety and issues during this time of the year, what are some of the tips that you would offer to help them through this period?
Yeah, so some tips I would offer to help people through this period would be things like starting off thinking about and identifying what you can control and what you cannot control, and really focusing on putting the majority of your efforts into those things that you can control in your life and that you feel like are health promoting. The second category of things I would really advise people to look at is to identify and adopt healthy patterns and habits during this time. So that might be things like doing cardiovascular exercise, getting your heart rate up and sweating. There's really good research that shows that helps to reduce depression and anxiety symptoms. Other healthy habits people can think about that we know can improve mental health could be things like making sure you stay hydrated, really paying attention to the quality of sleep that you're getting, really prioritizing a good sleep routine so that you are feeling well rested the next day. Also looking at what you're eating. The foods that we eat can vary person to person in terms of what makes a person feel good or bad, but start to pay attention to what those kinds of healthy eating habits might be for you, and try to stay with foods and drinks that make you feel good the next day. Some other items that I would recommend people look into doing during this time are look and see what kinds of holiday habits and traditions that you participate in, and think about whether or not those holiday traditions serve you, or if there's something you could do to alter them that might serve you better, might make you feel better at the end of the day. And then the last thing I would suggest that people really think about is, if you need help, don't feel bad about asking for it. There are people out there who are eager and willing to help support you through difficult times, and they're just a phone call away.
Absolutely. And I just want to thank you for being with us, because you've left us with some really good tips that you probably should take advantage of, and that is take steps to help prevent the stress that's around you, especially around the holidays. And remember not to abandon those healthy habits, just like Anne said. Take a breather and seek some professional help if you need it. And we want you to come back and keep making those healthy connections with us. Anne, thank you. Happy holidays to you.
Thank you, and to you as well.
We'll be right back with more. Stay with us. It may be the most wonderful time of the year, but it's also a very stressful season. In this special edition of Healthy Connections, we're going to get an in-depth perspective on mental health during the 2021 holidays. Now, this year, the emotional toll of the pandemic can be challenging for us all, but even more so for those who have battled COVID-19. Clinical psychologist Hector Rojas is joining us virtually from the SIM, which is the first long COVID-19 clinic in Puerto Rico and in Latin America. Since July 2021, the SIM has been implementing first of its kind long COVID treatment that includes mental health services, and the SIM's medical team could develop a model for other long COVID clinics in the United States, including here in Central Florida. Dr. Rojas, thank you for being with us today.
Thank you too. Thank you for having me.
So to begin, why did the SIM Clinic decide to include mental health as part of its long COVID-19 treatment? And also, can you explain to us what SIM stands for?
Okay. Long COVID is the remnant of the virus on our body. Okay, so the symptoms have an impact in the person, right? Some of the symptoms are fatigue, lack of energy, breath problems, chest pain, problem with memory, insomnia, heart palpitations, and dizziness. So all the symptoms have an impact in the daily basis of the person, right? So in the part of recovery, the mental, the health, the physical health have a connection with the mental health. So these symptoms have an impact in the emotions, just like frustration, depression, anxiety, and it's our job to deal with that symptoms of mental health symptoms to promote a healing process, a completely healing process.
And I just wanted to make sure everybody had SIM is an acronym and what it stands for.
Salud Integral en la Montaña. It's an
Got it.
acronym of health in the mountains, okay? Integrate health in the mountains. So in Spanish, it's Salud Integral en la Montaña. It's a corporation at 330 Federal Health Qualified Center. So that stands for it.
And you mentioned that some of the things that come along with long COVID-19 are anxiety and depression. I also wonder, how do the holidays add to that kind of mental unbalance that so many people feel this time of the year?
The holidays have, especially Christmas, have a perception that we need to be happy to share our time with the loved ones. So not all people have happiness, or no people have joy in Christmas. So the expectation of the society to the Christmas, and what I have depression have an impact in the symptoms, or have an impact in the person, because I don't feel happy in holidays. So what happened to me? What who is my? I have a problem. I am a weird person to not have happiness in Christmas. So that is normally what Christmas affect the holidays. Christmas have an impact in depression with persons. So there is some of theories about that, no?
And if we have family members or loved ones who we know are dealing with long COVID-19, or those who are just really stressed out around this time of the year, what are some of the triggers that we should be aware of when we're dealing with our family members to help them through this holiday season?
Family is an essential component in the recovery process in any health condition. Some of the behaviors, just like to talk about behaviors, that family should keep in mind are the person talks about fear of contagions of the virus, verbalization about guilt for being exposed, the loved one to the virus, lack of appetite, problems at work, problem falling asleep, pain muscles, in gastrointestinal problems, some health condition, critical chronic health condition being affected. This is the most points that the family will keep looking for a person have a problem with mental health related to COVID.
You know, here in Central Florida and many of the large Puerto Rican population that we have in Central Florida is planning to reunite with family and friends and traveling abroad to see them, traveling to Puerto Rico to see them. What would you suggest to them to deal with some of the things that have changed? Many of them haven't seen their loved ones in a couple of years. and things are different. How do you help them get through navigating some of the restrictions, navigating the fact that people want to social distance and may not want to hug as much? How do you make it through that?
That is important to talk about the expectation regarding the care and the prevention of contagion of the virus. It's important to talk about it and know if the person is comfort to have a hug or have here in Puerto Rico we are so physical. We express our love so physical. We hug a lot, we kiss a lot. So it's a barrier to deal with, to talk about, oh, I don't like the kiss, I don't like the hug. It's important to do that. Talk about the emotions. The emotions are important. Emotions are not the secret, the state secret. Okay, it's important to talk about. I talk about the fear of the virus. Talk about the expectations. Talk about the guilt, because it's the one way to deal with all these things. Okay, always keeping in mind the validation of feelings, just like to validate the feelings. So it's normal to be have fear in that time, to be depressed in that time, because we have dealing a lot in the few years. So another recommendation is make pleasant activities outdoors. We take a hobby, share with the loved ones, and all things that make this time of the reunited family be normalized and have a wonderful time, no? Because it's a lot we deal about it, no?
And, you know, this time of the year, there are layers of pressures on people. We've got the pandemic, we have the holiday season, interacting with people we haven't seen in a while. How do we, what would you suggest we do to handle things like emotional burnout and having to really deal with the layers of all of the things and responsibilities that and expectations that we have this time of the year?
The way to avoid emotional burnout or the pandemic fatigue is first is be aware if we have a symptoms just like a lack of energy, problem to work in the work or in the school, depressive attitude, problem to sleep. If we saw or we feel that is the time to get help, to seek help, because the burnout is real. We have a lot to deal, the stress, the pandemic stress, the use of mask, the vaccine, all these have a lot of stress in the people. So it's important to know about that the lack of energy, problems at work is the first triggers or the first symptoms people have to to precede the emotional burnout.
And I know Sim is working there in Puerto Rico to study the impacts of mental health on long COVID-19. How do the results of that study, how will they help with the rest of Central Florida in its battle against COVID-19?
Well, a lot of studies show that the mental health is a key component in the healing process. We talk about the connection of the body and mind. Some chronic disease, just like the diabetes or hypertension, have emotional compound, right? Have emotional connection, just like people with depression have to be tend to be have diabetes, and people with diabetes tend to be have a high probability to have have to be depression. So the study we conduct, we have here, is the impact of the long COVID in people, in emotional people, right? So this is the one of the first steps to being being shared of this experience to the old people, to our community. Okay, all the long COVID symptoms have an impact in our lives, and the person it's normal to be frustrated, stressed, and depressed. Okay, so part of our compromise of the community is to share this experience to other clinics to help them to build a robust health system that the protagonist of that is being the the wellness and in the states or the community in the states. So this interview is just like a first step of that to show the Central Florida people that we have doing that. So please contact us to share all the data or share all our experience to make more long COVID clinics all around the state. That will be great because people need it. There is no physical component without mental health. Mental health have a key component in the life of the persons. So it's important to people have a process or a mental health process to deal with all the stresses we have.
Well, Dr. Rojas, thank you so much for being with us, and thank you for the work that you're doing there at SIM and all the people who are working to help those dealing with long COVID-19. We appreciate your time.
Perfect. Thank you. Anytime.
And we'll be right back with more. Stay with us. Let's get an update from our state medical professionals. And joining me is Alvina Chu, Director of the Division of Infectious Diseases with the Florida Department of Health in Orange County. Alvina, as always, thank you for being with us today.
Thank you so much for having me again.
So, Alvina, where are we with the numbers of infection here in the state of Florida and specifically Orange County?
Right. So currently in Orange County, we've seen a slight uptick in the number of cases, new cases that we've seen. So the last couple of weeks when we've spoken, we've been classified in a community transmission of moderate. And just recently, we've crossed over into the next higher category of transmission, which is substantial or orange colored if you're looking at the CDC map. We've had about 72 new cases, 72 cases on average per 100,000 population, and our percent positivity for 7 days is broaching about 4%. And so this currently classifies us as a substantial level of transmission. And so that's us and some of the larger, more populated counties in the state of Florida. And there has been some increase across the United States recently as well.
And for those who don't know, I want to make sure that we note that we're talking about the coronavirus transmission and infection rates, because I did not mention that. But also, as it relates to this latest variant, the Omicron variant, what do we know about it?
So we know some things, and we know still not a lot. So we're really trying to get some information about whether or not it causes more severe disease, whether or not it's more transmissible or more easily transmissible, whether it can infect more people. So very early studies are that there's not been severe illness seen with infections with the Omicron variant. However, you have to take into consideration the population, and so we've seen some of these early cases are in younger people and in people who have already been vaccinated. And so that gives you not quite the whole picture of what the severity might be. And so we're still gathering information on that. And as far as infectivity, we're still working on that. There's still not that many cases yet. And so trying to determine how easily it's transmitted is still something that we need to work towards. So, which brings up that since we've seen these mild cases in persons who are vaccinated, it's still very important to get vaccinated if you have not yet been vaccinated with our current excellent vaccines, which are still, what we know now, still very effective at preventing severe outcomes, hospitalizations, and deaths.
Apparently here in Orange County, there's been a rush on the boosters because of this Omicron variant, so people are actually heeding the advice. Also, there are some unusual characteristics I've heard about the Omicron variant. What is that about?
Well, so on paper, there's been about 50 mutations identified, about 30 of which have been shown to be on the spike protein on the outside of the virus. And so that is one of the spike protein on the outside of the COVID-19 virus is what our immune system recognizes when it responds to viral infections with this virus. And it's also what our vaccines are targeting when it's trying to create the immunity in our bodies. It's not the only target, so I did want to emphasize that. And so these mutations, as I mentioned, it's on paper, and so trying to get more information about what the vaccine effectiveness is like now with Omicron, and in those who have either waning immunity or natural immunity, that's all still information we're trying to figure out.
One of the characteristics that we experienced with the Delta variant, for instance, was the increased transmission ability of the variant. Do we have that same increase with the Omicron variant?
It's still unclear. So as I mentioned, there's not that many cases right now, and so we're doing our contact tracing investigations, and that information will help us identify, just how many persons might be affected after being exposed to someone with the Omicron variant. The lineage, which is interesting, it's the B11529. The lineage is derived from Alpha and not from Delta, and so this part we need to identify may have characteristics like Alpha, which has been circulating for a while.
So the holiday season is upon us. I just got my first holiday event invitation for this coming Sunday. What should we be doing as we are gathering with friends, family, co-workers during this holiday season to keep ourselves safe?
Well, so we should still continue our pandemic precautions. And so currently, Delta is the predominant virus that's circulating within our community as far as COVID-19 infections go. And right off the bat, we won't know if someone has the Omicron variant versus the Delta or some other variants. And so using the pandemic precautions will help protect us against any respiratory viruses, even the flu or other circulating respiratory viruses. Right now, there's RSV, which is circulating. So our good pandemic precautions, such as often washing our hands, especially after coughing or sneezing, wearing a mask to help reduce respiratory droplet transmission, watching a good physical distance if you can, not being in crowded indoor spaces, and being in spaces with improved indoor ventilation if you're with a lot of people. And also, especially if you're immune compromised or if you're at higher risk for developing severe complications, to get vaccinated if you haven't yet done so, and to also get your booster if you're in the right time frame to get it.
Absolutely. Well, Alvina, thank you so much for being with us today. We always appreciate having your information from the front lines of this pandemic, and we appreciate your time.
Thank you so much.
We'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.